Recently, we saw Carl Gunnarsson of the St. Louis Blues go down with a bad-looking right leg injury, and this was a very tough one to watch because upon watching the replay, it looks like that his right leg really gets tangled up in a very awkward position. Now, on the actual play that Gunnarsson was injured on, we saw that he was skating over to the boards, and then when he got there, he made contact, and we saw that knee dive inwards, and he would require assistance to help get up off the ice. Now today we got some unfortunate news regarding Gunnarsson's case from the St. Louis Blues when they said that Gunnarsson will in fact miss the remainder of the season with a right knee injury. However, they didn't specifically say what exactly is going on at that right knee. Now the knee position that we saw Gunnarsson's knee go into is something clinically known as a dynamic knee valgus, and yes, we don't know exactly what's injured at his knee. However, based on this position, we can speculate a few things. Since some may not be too familiar with what exactly a dynamic knee valgus is and what types of injuries can be associated with this position, we will go ahead and take a look at that with today's video. Welcome, hockey fans. For those of you that aren't familiar with me, my name is Nick Gallo and I'm a doctor of physical therapy. And with this video, we're going to take a very close look at Carl Gunnarsson's most recent right knee injury. First, I'm going to start off by showing the actual play that Gunnarsson was injured on so that we get a good visualization for his mechanism of injury. Then I'll go over what exactly a dynamic knee valgus is and why this is so risky for the knee. And finally, I'll go over an appropriate timeline to recovery if somebody does in fact suffer an injury from this dynamic knee valgus position. If you like today's video and you find it informative, please hit that thumbs up and subscribe to the channel because I will be making more videos in the future regarding sports injuries, rehabilitation, and other physical therapy related content. Also, if you have any comments or questions, please leave those in the section below. Now to begin, let's take a look at the play that Gunnarsson was injured on.
We see here that Gunnarsson skates over towards the boards where he'll make contact here with his right foot, putting that knee in an awkward position. Afterwards, we see that he requires assistance to get up off of the ice, and as he's skating off of the ice, he seems to put little or no weight through that right leg. Upon replay, we see that as he makes contact right here, that right knee seems to dive inwards and he gets folded backwards.
Now here I have a model of the knee, and it's important to note that there are four major ligaments of the knee joint. And so the first one is one that we often hear about. It's known as the Anterior Cruciate ligament, or the ACL for short. And that ACL is actually located right in through here. Then we have the MCL, or the medial collateral ligament. That's located medially or on the inside portion of the knee, and that's right in through here. Then we have a ligament known as the lateral collateral ligament, or the LCL for short. That's located laterally or on the outside of the knee. And finally, we have a knee ligament known as the posterior cruciate ligament, or the PCL for short. And so when all four ligaments of these are intact, they contribute to the overall stability of the knee. There are also two other really important structures in the knee joint, and they are the medial and the lateral meniscus. And so these two pieces of the knee joint you can think of as shock absorbers because their predominant function is to allow the femur and the tibia to move on each other without bone-on-bone grinding. So without these two structures in the knee, or if one of them happens to become injured with a tear or something like that, it can cause that bone-on-bone grinding and it can be very uncomfortable. Now, at this time, we don't know exactly what is injured in Gunnarsson's right knee. However, I have brought up that term dynamic knee valgus, and essentially what's happening at a dynamic knee valgus, this is going to be when the femur is going to go into an internal rotation position, and we see that tibia go into an external rotation position. And usually when someone goes into this type of positioning, that will usually be seen as that knee caving inwards just like that. And so in Gunnarsson's case, as we see him skate towards the board and he makes contact, we see what looks like that knee caving or diving inwards, going into what looks like that dynamic knee valgus position. Now the ACL, as we saw before, runs from the femur to the tibia. And so a big function of the ACL is to prevent that anterior or frontward translation or frontward movement of the tibia. So sometimes when a person's tibia is going to move forward like this, That can be a mechanism for an ACL tear, but another big function of the ACL is to provide rotational stability of the knee itself. So typically when we see a player go down with this dynamic knee valgus or a non-contact knee injury when the knee caves in like that, this can also cause an ACL tear. So the fact that we saw Gunnarsson's knee go into what looks like that position puts him at risk for an ACL tear. There are also two other structures at the knee that can be injured in this dynamic knee valgus position, and they are the MCL, or the medial collateral ligament, and the medial meniscus. And this is because anytime somebody gets a valgus force, this is when a force is coming on the outside of the knee, and that's going to stress all of the structures medially or on the inside of the knee. What's very worrisome about a dynamic knee valgus, however, is the fact that it can affect the ACL, the MCL, and the medial meniscus, and we can kind of see that on this model here. So as the femur rotates inwards and you see that the tibia is rotating outwards, it's stressing that ACL. We see how the MCL gets taut, and it's also grinding into that medial meniscus. Now, not all dynamic knee valgus positions injure all three of these structures. However, this can happen, and it's known clinically as something as the terrible triad or the unhappy triad because it's affecting all three structures. Now, once again, we don't know exactly what's injured in Gunnarsson's right knee, but typically an MCL injury will not sideline somebody for the entire season. There are three grades of an MCL injury. There is grade 1, grade 2, and grade 3. And so grade 1 MCL injuries are considered minor, and typically a person will be out from anywhere between a few days to about a week and a half. In grade 2 MCL injuries, we see a person out anywhere from 2 to 4 weeks. And finally, grade 3, which is considered the most severe, a person's gonna be out for around the 8-week period. Also, meniscus injuries, they can be quite painful, but we typically don't see a person sidelined for the entire year with them. Usually how they're treated is they're going to be treated with a quick arthroscopic surgery if it's needed at all, and the person usually returns within 2 to 3 weeks. Now, of course, the big ligament that will sideline somebody for the entire season is that ACL. And this is because if somebody does get a complete rupture of the ACL, that's going to require that full ACL reconstruction. But there are grades for ACL injuries, just like the MCL, grade 1, grade 2, and grade 3. And so when you have a grade 1 ACL injury, you're going to get some stretching of the ligament. However, there's no tearing. Grade 2 ACL injuries are considered rare because you're going to get that stretching and partial tearing. And finally, grade 3 ACL injuries is when you will get that full rupture of the ligament. Now, once again, if somebody does have that full ACL tear, this will require that ACL reconstruction. And so typically when somebody has this ACL reconstruction, they're going to be out for at least 6 months. And so that's why when somebody suffers this, it just takes a very long time to recover, so they usually will put that person on injured reserve regardless of the sport because it will take the entire season to heal. Now, I of course have not seen Gunnarsson in person. I haven't treated him, I haven't evaluated him, and I'm just going off of the video and speculating, but it really does look like that right knee goes into that dynamic valgus position, and given the fact the St. Louis Blues have already said he's going to miss the entire year with this right knee injury, it really points to the fact that he might be dealing with at least an ACL tear. Now, if he's dealing with anything else besides that ACL tear, whether it be an ACL and an MCL tear, or that unhappy or terrible triad where the ACL, the MCL, and the medial meniscus are all affected, this can of course complicate recovery. So hopefully we hear an update on his case soon so we know exactly what's going on in the knee and we can really start to plan an appropriate time frame for his return to the ice. If an update happens to get released regarding Gunnarsson's case, I'll be sure to update everybody in the comment section. And if you happen to see one and you want to share it for everybody, please post it in the comment section as well. And that's it as of right now regarding Carl Gunnarsson's most recent right knee injury. Once again, if you really liked today's video, please subscribe to the channel because I will be making more videos in the future. Thank you again for tuning in, and I'll see you next time.